Am I on? I am on. Good. I'm Paul Irving, and I chair the Milken Institute Center for the Future of Aging. I want to welcome all of you. I see a number of friends in the audience, and we appreciate your time before lunch on Wednesday. Because it's lunch on Wednesday, we want to keep you around and keep you engaged. One of the things that I want to tell you at this point is we will be asking you for questions. And even though I have this remarkable group of experts in health, I'm a guy who used to practice law, and I actually taught law school. So for those of you who are disinclined to ask, I will be cold calling folks in the audience. Now, some people have already observed that there happen to be 4 women on stage and 1 man, and have asked me the reasons for that. And one of the things that I speculated was that maybe it's true that men are more interested in making money and women are more interested in making a difference, and that may explain the work of this terrific group that we have with us today. So all the way at the end, we have our very good friend Frida Lewis Hall from Pfizer, who's the chief medical officer there and a great and influential voice in the health community in the United States. Becca Levy from Yale. Loretta DiPietro from George Washington University in Washington, D.C., and Patricia Boyle from Rush Medical Center in Chicago. We welcome all of them, and you have their bios in your books so you can see all their accomplishments. So nothing is more important than health. It's the thing that has driven more economic growth in the last 100 or so years than any other factor, as we hear Mike Milken say very often. It's also, frankly, the single most important thing to all of us, a thing that we oftentimes don't recognize until we're confronted with the challenge of disease. And it's kind of incredible that we don't spend more time thinking about it, investing in it, talking about it, and addressing it in our own lives. So I want to spend a little bit of time talking about the research of the 3 women sitting immediately to my left. But Frida, you spend so much time speaking publicly, speaking on the Hill, involved with leaders in a range of domains related to public health, both in the United States and internationally. I guess my big question for you is, why isn't public health kind of a more urgent issue? Why is it something that seems to be kind of relegated to academic institutions and the back room? Why isn't it on the cover of the paper every day?
Well, and actually, if I can amplify that a little bit, is why isn't public health related to healthier aging really on the top of our to-do list, given what we're confronted with? I think there are a few reasons. First of all, we've really, public health, frankly, has taken what I'm going to call a stage gate view of aging. So if you really think about it, if you make it in the first day, your chances of making it for the first month are great. If you make it through the first month, your chances of making it to the first year are good. If you make it through the first year, making it to 5, even better. If you make it through 5, interestingly, your chances of making it to adulthood, okay, I'm crawling, I'm making it. If you make it through early adulthood, like 20, the chances of making it to 60 are even better. And then ultimately, if you make it to 60, the chances of making it kind of into your 80s and onto 100 increase. So we've really treated aging as this kind of crawling across each finish line, if you would, and increasing your chances to a longer and longer life. And so I think a part of it will be the shapeshift of, instead of a stage gate notion of aging, so getting past these age goals, if you would, to make it to the next, that we think of aging as a lifelong platform, so that if you make it to 100, it's not that you've run the gauntlet, but instead you're standing on top of a very firm foundation. And so I actually think of our prescription for a longer, healthier life, not necessarily as a prescription, but a plan. So how do we start in utero, if you would, for thinking about all the things that have to happen over time to build that foundation that ultimately leads you to not just healthier aging, but kind of this pinnacle healthy platform. And I actually have a slide that I think is, I'll call it an evolution, and I would love when we get to the question and answer how we might evolve this picture. It's slide number 6. And essentially, it's this life course approach. One of the first things that was pointed out when we were discussing this is I started in early life. I should have started, kind of in utero, because that's really when our healthy aging begins. And that we think of this as a life course of events. And we want to end up in this, with early life, vaccination schedules that make sense, early nutrition, brain growth, focus on development that really sets the firmest of foundations, and then to build that with nutrition and exercise and reducing the toxins in our life and improving a healthy lifestyle. Those are things I call external environmental factors, and then internal environmental factors, which we'll have a chance to talk about. So your attitude, does that make a difference? Your gratitude, does that make a difference? The other things that happen, your optimism, how does that shape your aging? And then, of course, your genetics play a part, and we're learning more about how genetics can play a positive part because we'll know more about them. And at the end, the key is really how do we keep people above the disability threshold for as long as possible? So what are the things that we can do as some of the impacts of aging take hold, no matter what we do, right, when we're younger? Some of the exposures that we have, experiences that we have may lead to disability. How can we squeeze ourselves above the disability threshold for a longer period of time? And I think you said, someone over here said, oh yes, well, women live longer. Well, everyone is living longer, and kind of. But if you really think about the time spent below the disability threshold, for some, we're not really living longer, we're just taking longer to die. And so what we really want is to honestly, right, help in a more healthy and productive manner live longer. And I think that we have some shifts in our collective thinking that will get us there.
So this is a perfect lead into the next portion of this. We've done plenty of panels at the Milken Institute on prevention and wellness and a range of things. So we spend a lot of time talking about things like obesity, nutrition, smoking cessation, et cetera. I think one of the most interesting things about this panel, and by the way, we're going to get to very specific individual advice before we're done today. So anybody who leaves for lunch early may enjoy their lunch, but they may live a shorter and less healthy life. So I suggest you stick around. The work that Becca, Loretta, and Patricia do is really very different. So I want to start by understanding just a bit about your research, the impact of your research. Much of it is novel. Maybe 2 minutes or so from each of you on what you're working on, what you found, why it's important, in plain English. So I'm going to start with Becca.
Okay, great. Thank you. So I'd like to share with you 3 findings that we have from our laboratory. And so the first finding, and these all have to do with the question of, is it possible that the age stereotypes or the way that a culture conceptualizes older individuals in that culture, can those stereotypes have a direct impact on older individuals' health and functioning? So the 3 findings that I'd like to share with you is the first one is that we have found that older individuals or individuals who take in more of these positive images of aging tend to have a 7.5-year survival advantage over those who take in the more negative stereotypes of their culture. The second finding that I'd like okay.
I mean, we got to put an exclamation point after it. I want you to say it again. Because it's really important that everybody in this audience hears this. We all are anxious about our diets and running around. But how many years did you say?
So those who take more positive age stereotypes tend to have a 7.5-year survival advantage.
Okay. Thanks, Becca.
Over those who take in the more negative age stereotypes or the ageism of their culture. The second finding is that we have found that it's not just quantity of life, but also quality of life, which seems to be impacted by these age stereotypes. And so if you can bring up slide 4, please. We found in a recent study that just came out that those individuals who take in more positive age stereotypes, and so in this figure it's the green line, they tend to show significantly less decline in hippocampal volume, which, as you may know, is the part of the brain which is associated with memory, and it's one of the chief indicators of Alzheimer's disease. And so we found that those who take in more of these positive age stereotypes have a significant advantage in hippocampal volume over time, this is over a 10-year period, than those who take in the more negative age stereotypes. And the third and last finding I wanted to share with you, if you could go to the previous slides, slide 3. And this is perhaps particularly relevant to the idea of prevention, which you had mentioned. So we found in a study looking at younger individuals, if it's possible that the age stereotypes that individuals taken at a young age, is it possible that those have an impact when individuals get older? And so what we found in this study is individuals who took in the more positive age stereotypes at a young age were, by their 60th birthday, were half as likely to have a cardiovascular event, such as a heart attack, after age 60. So this suggests the power of prevention, that we may really want to start at a young age thinking about these images.
Interesting. Loretta.
So if I had to define successful aging, I would use 2 words. One of them is plasticity, and the other is resiliency. And so plasticity is the ability to rise to a challenge, whether that's a cardiovascular challenge with exercise, or an emotional challenge with bereavement, or a perturbation when you trip and can recover. And then followed by resiliency, meaning going back to baseline function in a timely manner. So your ability to respond and return to what we call homeostasis defines success across the lifespan. And I think I speak with everyone. If we could have slide 1, please. I speak with everyone when we really emphasize that successful aging starts in utero. And our goal is to attenuate the aging-related decline in plasticity and resiliency. So the first slide, this is what I work on a day-to-day basis. We use exercise in the laboratory as a countermeasure for biological decline. No, we can't reverse it, but we can certainly attenuate this decline in function so that it takes longer to cross that disability threshold. I was trained under the model of Walter Bortz and Jim Fries, in keeping people functional longer and longer, compressing morbidity up to closer and closer to the time of natural death. So in using exercise with older people, on the far right, we know, and everybody knows, you can improve muscle function and quality with exercise of moderate and vigorous intensities. Most of my work deals with pre-diabetes and keeping people from crossing over. You can improve insulin sensitivity in the muscle, in the liver, and in the fat cells themselves. We know, if you look at the bottom, as we get older, that visceral depot starts getting bigger and bigger. We can positively affect that. But over on the left, what we can't do with exercise is guard against an aging-related decline in pancreatic function, insulin release. So now what we're doing is testing the timing of exercise. And we now apply low-intensity exercise to the time it's needed in older people following each meal. And we've demonstrated that 15 minutes of low-intensity walking after a meal can significantly lower blood glucose levels for the rest of the day. And that has huge public health implications right there. And then secondly, if you could show the second slide, I put there's another hat that I wear, and that's with community-based practice research, and following what you described earlier, we've been working with the DC Age Friendly project, and our goal in exercise nutrition sciences is helping them audit the built environment for older people in Washington, D.C. We'll discuss this more later on, but it feeds into the Aging in Place Village movement, and this is going to be a big part of what aging looks like moving forward.
Thanks. So, Patricia, before everybody gets up for a stroll, just in case they had a late breakfast, why don't you weigh in?
So my focus is on the prevention of chronic diseases in old age, common diseases such as Alzheimer's disease, other chronic conditions, heart disease, and so on. And if I could get slide 7, please. Oh, sorry. I had Frida's other one, different number. Let me, okay, 6, sorry about that.
Slide 6.
Is that? That's the life course approach one. There we go. Yeah. Okay. One of the major challenges that we're trying to address in our work is how can we promote aging well, that being longevity, but not just years in life, not just extending years of life, but actually extending time during which individuals are productive, vital, engaged, active participants in a community, working to the benefit of themselves and their own health, but also working together to promote vitality in the population as a whole. And this model that Frida presented looks a lot like many of the models we see when we talk about age-related changes in function, be it cognition, physical function, anything else. What people tend to show is a line increasing when you're younger to middle-aged, and then a slow but steady decline in function as we age. And I think that these kinds of views have been driven by research, but also promote the idea that aging is a time of inevitable loss of function. A more dramatic opposing view that we are trying to promote is that why is that the case? Why is it not possible that as we age, we continue to learn new things, we continue to be active, we continue to engage with the world and the community? Why can't our memory and other cognitive functions continue to improve? At the very least, why can't we maintain stability as we get older and maintain sort of a thoughtful, engaged commitment to life and involvement in life? So we've been focusing on behavioral factors that individuals can participate in to help promote not only longevity, but really living well, living a full life, doing things that make your life meaningful. So we have identified a number of factors. We now know that cognitive activity, stimulating the brain, physical activity, social activity and connections, and importantly, developing a sense of purpose in life, this sense that your life is meaningful, that you're intentional, you have goals you're working toward, are robust predictors of not only living years and years longer, but doing so with good health and with good psychological and mental health as well, which is very important. So people that have this sense of purpose and are proactive in their lives, engaged with other people, working toward goals and achievements, tend to live many years longer. They are substantially less likely to develop Alzheimer's disease and have about a 30 to 40% slower rate of cognitive decline as they get older. And this is true even among people that have some of the changes that we know are signs of Alzheimer's disease in their brains. So these things are providing a buffer. They also are much less likely to have cardiovascular events, be it heart attack or a stroke, as well as to develop disability. And in addition to that, I think importantly, people who are engaged, are purposeful, are intentional, sleep better, they feel better, they're happier, they're more optimistic, and they're more resilient. And I think that this combination of behaviors that really provide some resilience is something that we need to start targeting at a population level to really increase not only the health of our population, but the wellness of our population, the well-being, the sense that our lives are worth living and enjoyable both as an individual and also as a society. So if I could see slide 9, please. This is somebody else's slide, but I appreciate this slide. This slide shows for Alzheimer's disease the projected numbers of cases by years. And you're all, I'm sure, very aware that the number of cases of Alzheimer's disease is increasing dramatically and will do so in the next few years as the population continues to age. Now here what you're seeing is that if we could change something about the course of this disease so that we delay its onset by maybe 5 years, we could significantly lower, as in millions of cases that are going to develop. So we could have a major impact on Alzheimer's disease. For example, this is just one health outcome as an example. The problem is with medication, with therapies, we are not anywhere near doing this. We don't currently know how to delay Alzheimer's disease or treat it. We don't have a viable focus right now that's going to show us this reduction in number of new cases and number of disabilities related to Alzheimer's disease. But what we do have is a tremendous opportunity at a behavioral level. If we are able to engage individuals of all ages to become cognitively active, use your brain as a muscle, use it like you use your body muscles, become physically active, and really figure out what makes you tick. Find your purpose in life. Get out there, get engaged. And these things at a population level actually could have a major impact in terms of reducing the number of cases of these kinds of diseases, and also improve quality of life, I think, at a much broader level for people of all ages.
So let's just take a step back and breathe for a minute, because if what we've heard is true, and you've now heard the research, 7.5 years, dramatic reductions, mitigation of risks associated with chronic diseases and cognitive decline, delay in Alzheimer's and other dementias, the potential impact of this, not only on individuals but on society, is massive. I mean, Alzheimer's and other dementias, uncured, unmitigated, will break the United States and break China first. So why don't we, why isn't, where's the press release from the White House? Why don't we have a sense of urgency about this? Why isn't this something that's in public conversation at every dinner table in America, in every discussion in business, in every HR office? Among employers? I mean, do any of you have a reaction to that? Is it, I always think of translational science. You think of translational science, I suspect, as the ability to get things from lab to bedside. I think of translational science as the ability to get oftentimes some very, very good news into public consciousness. What are we doing wrong? Frida?
I want to answer it on two levels.
Okay.
So one level is I think that our natural propensity to delay our thinking about things like aging is quite interesting. In fact, if I could get slide 5, how old is old? And so this is from a poll, right, that says 18 to 29-year-olds say, oh, it's 59. And that's 30 years away. And then if you ask people 30 to 44, so now it's creeping up on me, it's only 25 years away, so it's 69. And then when you get to be 45 to 59, you're like, okay, now it's right up on me. 13 years from now, it's 72. And then when you kind of pass the 60-year mark, it actually starts to drift away a little bit. So if you think about the paradigm of, I'm 29 years old, and you're telling me that nutrition and exercise and purpose and all of these things are going to make a difference to me down the road. Down the road is just really too far for me to think about, right? So I think that at the personal level. And actually, I wish I had my daddy up there. He's 97, and he still walks into the room and says, I'm going to sit over here. Look at them old folks over there. So I'm not quite sure how old those old folks are, but they're apparently much older than 97. So, it's, our ability to get our heads around that distance from us, I think, is really a natural, kind of a natural phenomenon That's for starters. And if that's what we feel at the personal level, where we can honestly make a difference for ourselves actually doing something, imagine what it means for us to try to think about how to do that collectively. So I think a part of it has to do with, kind of the distance away from us of the challenge.
Patricia?
Paul, I agree completely with that. I think ageism, some of these other isms that prevent people from wanting to think down the line, and also maybe lack of incentives for the present time are problematic. I think another issue that we have got to confront is the medical model within which all of our public health efforts are employed. So currently, I think it's just over 4% of the federal budget for health expenditures goes to prevention of disease. 4%. Prevention of disease is by far the most effective strategy to reduce the burden of disease across the population and at all ages. But 4% is where we're at the moment. It's insufficient. And along with that, our medical models are overly focused on disease, almost to the exclusion of what it actually means to be healthy. I mean, think about it. Has your doctor ever said, how do you feel about your life? Do you think your life is meaningful? These are not conversations that are percolating down from doctors to patients, from policymakers, and so on.
And part of that has to do with reimbursement, obviously, with pay. If doctors aren't paid to ask the question,
right,
the incentives go the wrong way.
Right, absolutely.
Loretta?
So I would need to add to that, and we're not investing in prevention as much as we should be, and whether it's with reimbursement or incentivizing people to stay healthy, but also with research funding, and especially prevention in the area of aging. The NIA has the lowest, National Institute of Aging has the lowest pay line relative to other institutes. And so for us, it makes it very, very difficult. And if we're all doing our jobs and doing it right, nothing happens with prevention, especially aging, right? You're just keeping people, you're maintaining. And I guess that's not as sexy as curing some big disease.
Well, and even curing is only, 3 to 6%, something like that of the federal budget. So 90% of the federal budget is treatment and care, the least efficient portion of
So the return on investment really is at the highest at the preventive end. No matter what behaviors or things you're talking about, that's where the greatest return on investment is.
And
Becca, comment?
Well, and just to add to that idea, so if prevention is so important as we've all been finding, then it seems like if we could intervene in the conversation at a young age, so really get into, so we know that children as young as 3 or 4 already have taken in the beliefs about aging of their culture. So if we could find a way to actually intervene at that stage and change how children learn and the kinds of messages that we're giving them through media and marketing, I think that might actually bring about a change, yes.
Well, and I think the other part is the conversation that you get started early enough. So Pfizer launched a platform, Get Old, some years ago, to really kind of galvanize and to gain insights into conversations around aging. And we're really finding the distance, the cultural distance that you've suggested, where aging is a terrible thing, and I'm worried about this and I'm worried about that. The closer you get to it, and the more you understand that you, with purpose and having done many of the things to protect your health, you're in a great position to have an impact far beyond what you thought you could. That seems a distance. I was asked in an interview once how my dad inspired me. And literally one morning I woke up and I looked at him and I said, oh, if this is going to have to last me 37 more years, I better get my game on. Because I wasn't thinking that way. I was thinking it just had to last me till tomorrow morning, right? And if I could just get through the day. But when you really begin to see what you could do with it if you took care of it in the distance, and we have to start that, I agree with you, at 3, not at, well, I won't tell you what age I was when but the idea is to kind of push that thinking, way down into the earliest of ages, and then to nurture it all along so that people could actually live in that mindset.
I just have one more thing to add. We now have epigenetic evidence to suggest that the maternal environment is really key in setting the stage, right? We see it, maternal exercise and physical activity during pregnancy, reactions to stress, etc., and how that sets the stage for childhood, or with some things like obesity and diabetes, it may not show up until puberty or later on. And so we now have information that successful aging starts in utero.
This question of discussion with young people, I think is really interesting. Last year, we had a session. Frieda, I don't know if you were sitting in with us, but we had Joanne Jenkins and Laura Carstensen, Mark Friedman, who was here earlier, and Michael Eisner, who had just started focusing in his philanthropy on intergenerational programs. And we were all talking about how to begin conversations with children about aging. And Eisner came up with something that I just thought was brilliant. He said when you engage in a conversation with a child, you tend to ask, you kind of get down on their level, so eye level, and you ask them what their interests are, what sports they like to play, and all the rest. And inevitably one question comes up, and the one question is, what do you want to do when you answer the question? Grow up. And Eisner said, it's the wrong question. He said, we should ask them, what do you want to do when you get old? Which I just thought was a brilliant way to introduce that conversation into households. And you're really right. Look, young people in the wake of the Human Genome Project certainly have the prospect of longer lives, and we know that there's debate and discussion among bioscientists about what that's going to mean. Is it going to mean 4 or 5 more years, or is it going to mean, 200 years, as somebody up in the Bay Area says? I discount that. I suspect we all do on stage, but the prospect of significantly longer lives exists. We have Art Levinson at Calico, one of the pieces of Alphabet, one of the things that was broken out when they broke out the search engine. Levinson was the guy who was the chairman and CEO of Genentech, running now Calico, focused on increasing longevity. We have the Palo Alto Longevity Prize. And yet, when I have conversations with people about their lives, I hear much more about kind of the question of not how do you add more years to your life, but more life to your years. And so I'm interested in why and how we accelerate that conversation, because the work you're doing is extraordinarily powerful. Frieda, it looks like you have more to say.
Can I just do why
Please.
why not for a second?
Please.
Because we talked about the medical model, and
Yep.
if I could do slide 7, and essentially it's what's in front of us. So if I don't know if our model built the issue or if the issue we're trying to respond to with our model. But if you think about the incidence of major conditions and how they increase with age, I think it's striking that, and quite unintentional, that the top bar is red. But the notion is, over the ages, most illnesses, chronic in particular, almost any cancer that you can name, heart disease, hypertension, arthritis, diabetes, we could just do slide after slide of these, that with increasing age you get increases in these chronic, debilitating often diseases. And so, if you're of that age and sitting and in need of help, then I think a system is attempting to try and respond to that need in the near term. So it's an and, not an or, right? So how do you deal with this that's facing us right now today, and build a public health system that is transforming that for the long term? And kind of, if you ask me what we could do differently, it is perhaps in part thinking about how to build a system for the and. Right now we have just this one side of it. We tend to think of things on one side of the equation. Perhaps if there's a way to intersect kind of managing the current and projecting, preparing, and creating the future, we might have a better shot at this. And I'm not quite sure exactly what that looks like, but I feel like it's the winning formula.
It's a really interesting point because although in a sense I'm from neither of these worlds, my observation is I go to conferences and meetings of bioscientists, medical researchers, the pharma industry and the like, and people in that ecosystem exist. And then I go to meetings with public health types, community health types, et cetera. That ecosystem exists. And you're right, they need to get across the street more. I think it's a really interesting point. I mean, you know, the last time I looked, with due regard to those who like to talk about the singularity, death rates remain constant at 100%. So you know, I think we really do have this question of extension of this what some call health span, this period of deferred disability, et cetera, and increased productivity. And again, this is not just important for individuals, it's massively important for society. One of my criticisms of the world of health, and oftentimes my friends who are health economists, is they talk about disease costs, but oftentimes don't build in the losses of productivity and costs of absenteeism, presenteeism, and all the rest, by the way, not only of disease sufferers, but of caregivers, about 50 million in the United States. And if you add in those numbers, the case for increased investment, both in public health and medical research, is frankly mind-blowing. And I think a lot of people don't understand the return. Patricia, you look like you had more.
I was thinking of the longevity benefit.
Yep.
That I believe I can't think of who coined it.
I think our friend Linda Fried talks a lot about longevity dividend and a number of others. But
yeah, but I think you're tapping into an idea where if we take projections of aging and the increase in the number of older people, and we consider them as productive, active, potentially working, sometimes in encore roles, which might not be, you know, full-time standard jobs, but some type of helping, you know, kind of position or productive position. It's estimated that, you know, older people can contribute $8 trillion, I think was the most recent number
maybe Mark Friedman,
put out in terms of economic prosperity. So I think this all ties back to, you know, to the extent to which we can see older people as productive, contributing members of society, we have not only social and public health benefits, but huge economic potential.
Absolutely right.
I like to say that public health starts with you. And so, you know, I think we're seeing more and more a modeling by middle-aged and older people of what healthy and successful aging should look like. We see it in our aging in place villages. These were grassroots organizations, older people coming together to meet their own needs. To me, that's what health promotion is all about. They're organized, they're political, they vote, and it's incredible. And I love seeing these grassroots movements that are really taking over. And it starts with us and our modeling. And I'm not ready to give up my dream of pitching for the Yankees, trust me. I'm just going to carry that.
So before we come out to you, and again, we're going to get to a couple specific, specific recommendations for every person in this audience. But I want to ask all of you a question. I can't ignore the fact that it's political season. None of us can. Yes, we all flipped on, you know, MSNBC or Fox or CNBC or whatever it was when we got back to our rooms to look at what happened in Indiana. So here we are. We're now at an inflection point. I'm going to appoint all four of you for about a minute each as the chief health advisor, the chief health strategy advisor to the two presumptive presidential candidates. Frida,
Can
breathe.
I be last? Please let me
Frida
be
has to
last.
breathe. Frida has to breathe, but Frida breathe. So in that 1 minute, what do you say that they need to be thinking about and doing to dramatically change the world of healthy aging? You want to go first, Patricia?
That's a tough one.
Yep.
I'm going to go back to one original point that several of us have made, and that is that we have got to shift the focus away only from disease management to disease prevention, and we've got to take a life course approach. I absolutely agree. Behavioral and other modifications and interventions have to begin in childhood, and they have to be built in to our way of functioning so that people do what it takes to promote their own health and contribute on a broader level throughout the lifespan. So one is focus on prevention. Another thing, and this may seem a little bit out there, but it's something I've been thinking about lately. I think we really would help our society, not only in terms of public health, but more broadly if we did some risk literacy training. I think that people tend to fear things that they perceive as being very large risks right now. So ISIS is a great current example. And then people want to invest in those things, move on those things, mobilize resources to deal with those things, when in fact the true risk, the absolute risk of some of these things ever affecting one person in this room or one person at this conference is near zero. So I think if our population had a better sense of what is it that we really need to be concerned about. Is it Alzheimer's disease when 50% of people over the age of 85 have it? I think so. You know, is it heart disease, which is one of the top killers in this country? Of course. Those things are real risks. I think at a broader level, if people had a better handle on assessing true risks to the population and to the individual, we'd have better allocation of resources.
Loretta.
So I echo the investment in prevention. And I also think there needs to be a better commitment by the government to designing these age-neutral communities. Bring back, you know, building incentives for the 3-generational housing. It would solve a lot of problems. Have some student debt repayment option where maybe students can get some of their debt reduced by living with older people as family.
And realizing benefit at the same time.
Exactly,
Yeah.
and we've got to be more creative in how we design our communities.
Becca.
So if I had a chance to talk to the next president, I think I would, again, encourage us thinking about intervening at an early age and thinking about an educational approach that starts with young children. I think I would encourage the next president to also think about a workforce that is very intergenerational, and I would make the point that it's not just a changing perception, but it's also, there's much value to older workers. So there's research that shows that when older workers come into the workforce, that they tend to be more productive and they work better in teams than some younger workers. So there's real advantage to the country. And then the third thing I think I would encourage the next president would be to think in a global level of how we could strengthen human rights. And for example, there's a convention that's making its way through the United Nations right now, and I think I would encourage them to sign on.
All righty. Frida. This is after you breathed.
I breathe, equanimity. I actually would ask them to do a different kind of moonshot, right? One around translation. So I talk a little bit about my dad. I talk a lot about my dad and what an inspiration I think he is for healthy aging. But my life's work is really around the discrepancy between my father at 97 and my mother who died of a stroke just shy of her 52nd birthday, and how that discrepancy happens to us. And my mother died in 1977. In 1950, the results of the Framingham study started to bear fruit, right? The first report started to come out of that study. We learned about cholesterol, we learned about hypertension, we learned about the risks of smoking, 1950.
Remind us for 1 second about what the Framingham
So
study
the Framingham study was this kind of large longitudinal study around cardiovascular disease. Actually, data is still being collected, multi-generational today. So the first reports started to bear fruit in 1950. 27 years later, my mother died of a stroke. And in the intervening years, report after report had come out about the risk of smoking. She was a lifelong smoker. About high cholesterol, we knew nothing. It hadn't translated either into statins or kind of a public health platform for testing and management. Hypertension, those things hadn't taken part. Policies around smoking cessation, all the things that we started to see 30, 35 years after the first evidence that we could make a difference. So one of the things, so we've got brilliant researchers here. We've got data abounding that tells us what we could do as a world to make a difference. But I'm nervous that the translation will be as slow as it's always been. So I would suggest maybe an accumulation, right, and a guide, if you would, out of the existing data that we do have to speed policy implementation, to speed culture shifting kind of work like designing cities, and then amplifying research so we learn more and can translate some of these into diagnostics devices, medicines, and behavioral changes.
So maybe some people out in the audience have an idea about how to turn 30 years into a conversation that should happen in the next 3 months. So it's now your turn. We have questions. Hands back. Stand up if you would. Just quickly identify yourself. Please keep it to questions, not speeches, and feel free to direct.
I'm not into speech making.
Thank
Jeff
you.
Hogan. Hi,
Thank
nice
you.
to meet you.
Thank
Thank
you.
you for the panel. It's great. On the presidential advice, the one thing none of you talked about was setting a personal example. And we have, and set politics aside, we have in Donald Trump somebody who prides himself on the fact that he only sleeps 4 hours a night with his BlackBerry next to him so he can tweet all night, and he doesn't exercise, and he likes to eat hamburgers. So, but yet, I guess by contrast, we've had 16 years of presidents, Bush and Obama, who do exercise and were relatively fit, and yet it doesn't seem to impact America. But any comment on whether or not actual personal example from our leaders is important?
Anybody want to take that? I think Frida. I see
Don't look at me.
She's
I'm wiping
She's
the,
bursting.
I'm wiping the bacon crumbs off of my shoulder right now. Yes, I think that we need role models for sure. And personal example is, to me, tremendous. Not everybody will receive or respond to personal example in the same way. So I think it's the combination of personal example or personal kind of admission of the need, and then example and action together.
Yeah, it raises a very interesting point. I mean, Michelle Obama was an incredible role model for children, for women. I mean, she's down doing push-ups and goes around exercise, doing gardens, and that didn't really seem to help very much. So I don't know. I certainly don't think Trump doing push-ups is going to help. Terrifying song.
By the way, that's going to be the one outtake that ends up on YouTube. Go ahead.
Part of my training was as a clinical psychologist. And clinical psychologists always say, insight does not equal behavior change. So we know that people know what's good for them, they know what they should do, they may even have role models, and they don't do it. What we need is to create environments that encourage active, healthier lifestyle at a community level, and it's going to come from the community on down to the individual. So I agree, good role models are optimal, but I don't know that it's enough for behavior change, as you point out with Michelle.
I just have to add this. My husband always says people don't change when they see the light, they change when they feel the heat.
Yeah.
My name is Byron Boston. I'm president and CEO of my company. I've got about 20 employees. And so I've put a gym into our office. I've got a cabinet full of green tea, black tea, oolong tea. What else can I do? What else can I do to influence my staff? Obviously, it impacts our healthcare costs of our company. So.
Can I just add on to that question? So it's a fantastic question, not just for a 20-person work staff, but what would you say to people that may have 100,000 employees? And frankly, what would you say? We may have investors in the room who may have interests our friend Risa Mori at the Robert Wood Johnson Foundation talks about building a culture of health, not just in communities, but very much in companies. So
Invest
please
in
take that.
standing desks.
Yeah.
Because with the thing with the gyms, the same people that use the gyms outside use the gyms in the workforce. Invest in standing desks, invest in building design that makes the stairs the default choice, make the printer at the far end of the hallway so people have to walk. There are all kinds of design issues that are very effective in promoting movement through the workday. Remember, you have a captive audience. Same with schools.
I see one of my associates in the audience, and she'll laugh when I say this, but I routinely walk by her office and I say, walk with me, because I'm always heading someplace, so do walking meetings.
Can I add just a couple
Frida.
of things? So, you know, the ever-evolving story around sleep is really critical, and so designing your culture so that you're encouraging people to get enough sleep during the night and that they're not burning the candle at both ends in order to complete their workday. And also stress reduction is something that we didn't really talk a lot about as an active opportunity. In many cases in the workplace, there are many opportunities to create timing, interactions, relationships that reduce stress. And there's actually a friend at work measure, right, which really talks about relationship building in the workplace as being a natural facilitator to some of the healthy behaviors that we just talked about.
Ariana Huffington, by the way, has a new book out on the benefits of sleep.
Sleep.
Sir in the front row.
John Reedy, retired at Drexel Burnham. Just a simple question. Pet ownership, is that a significant factor? I'm really thinking about dogs rather than goldfish and canaries, but is this something that should be recommended?
Anybody want to take it? Any
Yeah, I
pet
do.
experts?
I think it's fantastic. We've talked about challenging the body, the mind. So think about when you have a pet that needs to be tended to. You're getting exercise. At the same time, you're having to deal with the environment outside, right? You have to navigate. You have to watch it cross the street. So anything that engages the body and the mind as frequently as possible throughout the day is, I think, key.
And they encourage purpose and optimism.
Yeah.
Yeah. Social.
Thank you for all of your comments. Laura Ladd, I'm the chair of the board of the Wyoming Pension System. I've heard you speak a lot about solutions, but I wondered if I haven't heard you say much about substance abuse or mental health issues or some of the impediments that make perhaps some of the pursuit of the things you've discussed harder. There are probably other impediments. Could you speak a little bit about how you weave that into the solution, really from a pragmatic standpoint, knowing how many folks are impacted by particularly increasing use of prescription medication,
Well,
things of that
and-
nature?
And we know it's by the way, the one segment of the population that is not experiencing increased longevity is actually Caucasian populations isolated in certain states who have issues related to opioid use and suicide and guns and the like. So who wants to take it? Who wants to weigh in? Frida, you have thoughts?
I do. I was thinking we just need another couple hours for that.
Yeah, good question.
Just a couple of points. One is we have an opportunity, I think, to do two things. I'm about the and. So one is to do, frankly, a better job of diagnosing early and treating mental illnesses and managing them at their primary state. So, you know, if you think about the status of addiction diagnosis and treatment, you know, we've got a long way to go. If you think about the work that we're doing in treatment paradigms, in biologically based treatments or otherwise not making as much progress as we would certainly like. So I think we have a whole range of things that we could do around mental illnesses and as a part of that, substance abuse. We also have an opportunity, I think, to pay attention to what happens with the other health habits of people who have mental illnesses. Smoking cessation is a great example. So the rate of smoking in people with mental illnesses is 2 to 3 times what it is in the general population. They tend to die 25 years earlier generally from these smoking-related illnesses. And that may be a code that we could crack more simply, if you would, as a part of the overall paradigm. So I think we have to look after the nutritional, the smoking, the exercise, all the things we would look at in our general population, and to apply those things as aggressively as possible, and then also significantly up our game in diagnosis and management across the spectrum of mental illnesses.
Patricia's got a quick one.
I
quick
think,
response.
again, what we're talking about, that's a great question, but what we're talking about is the mind-body connection. We need to keep reinforcing the idea that what happens in the mind has a major impact on the body and vice versa. And so I think you're right, addressing those things with the idea that substance abuse, depression, mental illness, all forms, really have to be dealt with on a whole person level.
We've got time for one, I apologize, one very quick question, and obviously we'll have some more time. So very
Thanks.
quick one.
Great comments. We haven't talked much about nutrition specifically, and I guess I know that's part of prevention. One of the things I've learned recently that I've struck by is that how little training medical students get in issues related to nutrition and prevention. Can you, and I guess some of this, maybe I can just put in a quick plug for a book that I read recently that I found to be wonderful called Whole, W-H-O-L-E, by Colin Campbell, who's a professor at Cornell, who talks about a lot of these issues, and specifically the case for a plant-based diet, but specifically on the issue of doctors not really getting trained in this and not really offering, often, from what I read, not really actually having a lot of knowledge or information that is scientifically based related to nutrition and wellness.
Anybody here think medical school training has to be changed?
Oh, God.
Yeah. So.
Yeah.
Well, yes, and is, actually. I mean, I think it's a slow evolution, but nutrition clearly is beginning to become a front and center concern in medical education, as many universities are going to more holistic training and team-based training. So at the medical education point, we're beginning to transform the way we think about it and stop doing the verticals of anatomy and the systems as all different, and then asking someone to put them all together when a patient's sitting in front of them, but instead to teach it as a whole body phenomenon, and then to expect it to be applied that way. So I think you're seeing the shift. The challenge that we have is by the time the student gets there, right into the offices to treat patients, you've now got 10 years, depending on the length of a residency training, before these new practices are put into practice. So we're hoping that there are ways to accelerate into the now, into the clinical work that happens in medical environments, the exercise, the attitude. You asked the question, whoever asked that, and so on and so forth.
So Loretta, real
Yeah,
quick.
so I agree with you. As long as there's nutrition is important, as long as there's equal time given to the importance of physical activity, right, across the lifespan. Many times we forget that. And I would like to see it, those two questions asked at point of contact. You get your blood pressure taken, all this stuff. I have the only physician in the world that says, what are you doing for exercise?
So we literally have just a minute and a half or so, but I'm gonna stretch it and say in maximum 30 seconds, I'm cutting you off. I want a very specific piece of advice for every person in this audience walking out of here. Is there something that they can do today to improve the odds, no certainties, improve the odds of not only increasing their lifespan, but their health span? So, Patricia, 30 seconds.
Keep giving
Here
me
it
the
is.
hard ones
Yep.
first. Get out there and find a purpose in life. I think find what invigorates you, what is energizing to you. Spend more time focusing on that, doing things that are within that sphere. This will lead to cognitive activity. It will lead to social connections. It'll lead to more interaction with your environment and overall a healthier lifestyle. It's get engaged, get in the game, and find what drives you.
And don't stop.
Don't stop.
Don't let age.
That's right.
Don't by some chronological age cutoff. Loretta.
Whenever, every day, whenever you have the choice, take the stairs.
That's good.
That's a good one.
Becca.
I would say question the negative age stereotypes and ageism that are everywhere around us, and really try to think about, does it actually apply to older people I know? Does it apply to myself? And also find ways to bolster these positive images of aging as much as possible. Find older role models that you admire in literature, movies. There's a lot of great images out there that we can reinforce.
So intern, Best Exotic Marigold Hotel, et cetera. Frida.
Eat well, sleep well, and play well.
And the last piece of advice I have is listen to people like this. It's going to make your life better. Join me in thanking our panel.